The Mississippi Delta. Once, this stretch of fertile land was king of cotton and gave birth to the blues. Stars like B.B. King grew up here.
Oh, worry, worry, worry.
And these days, there is still plenty to worry about. Illiteracy, poverty, and poor health plague the region. People here have some of the highest rates of diabetes, obesity, and high blood pressure of anywhere in the country. Now the federal government thinks it can help fix the Delta's chronic health troubles with 21st century technology. Using $15 million in federal funding, the Delta Health Alliance is bringing in new computerized medical records in hopes of transforming the region's ailing healthcare. Debra Richardson is exactly the kind of person the government is trying to help.
Well, next month I'll be 53. And if I don't hurry up and get somewhere with get some decent health going on, I don't know about 54.
For nearly 21 years, Richardson taught elementary school, but in 1999 her health started to deteriorate.
Blood vessel burst in my head. Ever since then, I've had every kind of illness you could think of just about. High blood pressure, diabetes, sleep apnea. I got so many ailments I can't even think of all of them right now.
To get help, Richardson turned to the Good Samaritan Health Center in Greenville, which is one of the clinics at the forefront of the government's effort to get physicians in the Delta connected electronically. With the new computer systems, they envision doctors easily pulling up and tracking patients' medical histories wherever they seek care.
I see you had an appointment in the morning.
Still, it's hard to get people in the Delta to go to the doctor before there is an emergency.
People don't just up and go to the doctor around here. When you go to the doctor, it's because you're sick. You don't go there for maintaining health. You go there because you're sick. And usually you're very sick when you go.
There are many reasons people don't go. No transportation, no money, not enough doctors. The Delta Health Alliance is also trying to tackle these problems by pushing for better nutrition, literacy, and job development.
One thing that really ties it together, though, in my mind, is to be able to track all of those things through an electronic means. Because if you can, then it makes us be able to react better and faster. And so I think if we are successful in this, we make people healthier earlier, and we make them sort of seek primary care when they should, so that they don't have to go to the emergency room.
Hopes are high in Washington that adopting the technology can help patients like Richardson manage their care before it becomes an emergency. Nationwide, the federal government plans to spend $27 billion in stimulus money to encourage doctors and hospitals to switch over from paper to electronic medical record systems, which they claim will save billions in the long run. But some doctors in the Delta are skeptical. Dr. Carlton Gorton is planning on taking his clinic digital in the next few years, but doesn't think technology will work the wonders that so many in Washington claim.
I don't think it's going to make me check something more often because I'm already doing all of that. I don't see it making any huge impact in my practice.
At the Good Samaritan, it's too early to measure the success, but since they put in a digital system last year, they've been able to better track patients' illnesses and get lab results quicker. But will that translate into better health care for patients? For her part, Richardson has no doubt it will take more than a computer.
My biggest problem, I don't eat right. But I take my medicines, take them correctly. Right now, I'm trying to get this blood pressure and this sugar controlled. So I'm trying. I want to get back to decent health. That's what I want to do.